Right. So record is active. So yes, the session is recorded and you'll be able to view it online after, and hopefully in about a week or so once we get it up there. All right. So let's talk about Thriving Your Workplace. Some of you may be familiar with our program. Those of you who aren't, Thriving Your Workplace is a program aimed at helping local employers with workplace mental health strategy development. And so we work with them to integrate mental health support at their workplaces. And so we know that mental health support promotes emotional well-being. We want to also help people facilitate access to mental health care and just create positive mental health friendly workplaces. So we work with many employers over various sectors, typically customizing workplace mental health strategies for them based on their needs and their goals, what they want to achieve, and helping them implement those recommendations with technical assistance. We also have done a lot of free training. This is our 21st event, I believe, virtual event since COVID, and we provide tons of resources and events, all of which you will be able to view on our website. We'll have the link in there in this presentation towards the end. As again, I mentioned, I'm Christopher Logue. There's my photo up there. I know I might be on camera, but you only see slides. And my colleague, Sophie Pose, there are titles. We're very happy to be with you. Sophie will be jumping in when it's her time. So real quickly, the agenda for today, we're going to introduce mental health and racial equity. We're just going to have that conversation. We want to talk about strategies to promote mental health equity at work. We're going to explore the merit framework, which is very, very intriguing and potentially very useful. We're going to have breakout sessions after that for us to break into smaller groups potentially and discuss this. And then lastly, we're going to, we're going to return and share, but ultimately we're going to end the presentation with resources that can be used to further push this work forward. All right. So now in terms of our introduction to mental health and racial equity. Before we, right, and so just like, right, and so it is just the state of well-being in which people can cope with the normal stresses of life, right, and be productive, contribute to their communities, their families, so on and so forth. So we all have that mental health. As we transition through this spectrum, mental health challenges, excuse me, things that we experience that may cause distress, right? So that could be, you know, day to day, just moments of feeling anxious or lonely or depressed. But we all potentially can experience mental health. So illness, we always talk about as diagnosed conditions by a mental health professional, right? And so, and these are things that affect people's day-to-day, right? And this might be clinically depressed depression, right? Or clinically depressed anxiety, or people who are diagnosed with schizophrenia, for instance, right? So not everyone has mental illnesses. Some people may have mental illnesses. All of us go through mental health challenges because all of us have mental health, right? So we always like to provide this base foundation for our conversations. Ooh, went too far. So in terms of how mental health challenges affect us, it affects us all in different ways, right? And so here in New York City, 1 in 5 adults experience mental illness in any given year. And this is the same as the national average, right? And so this is people who are diagnosed with a mental illness, right? So 1 in 5 people may be diagnosed, but those of us that are around this person who is diagnosed may feel some type of effect as well, right? So whether that be a family member that is diagnosed with mental illness, all of us as a family working collectively feel that experience, right? Or a coworker that may be diagnosed with a mental illness, we feel that collectively, potentially, if that person shares it, right? Suicide, 6th leading cause of death, oftentimes tied to depression, right? So certainly a mental health challenge. And I want to go to the last point. Mood disorders, which are a classification of mental illnesses, are the 3rd most common cause of hospitalizations for both young people and adults, 18 to 44. And we always like to highlight this age, 18 to 44, because most of us are working predominantly during those years, right? Some of us are students at 18 in college. Haha, hooray, good. But most of us are working during this time period, right? And so for us working adults, mood disorders are a very common reason for hospitalization, right? So that speaks about the effect of mental health challenges. COVID-19, we are nearing a year since we've had these stay-at-home orders put in place at first, right? And COVID-19 is still around, hopefully ending soon, right? With the vaccine getting pushed out. But it has had effect on people's mental health, right? Here are some data points from Psychology Today, 85% of people feel worried or anxious that they themselves may catch COVID-19, right? Another 85%, or additionally 85%, feel worried about losing their job, right? So we know that COVID, people are scared of catching it, but also has had an effect on the economy. And just in general, people are really struggling with employee-related matters. 84% reported that, right? And that can range from mental health concerns, changes at work, managing money at home. I'm sure education is a concern. Those of us who have children, right? In terms of people of color, there has been a disproportionate effect, right? And so community of colors are experiencing that job loss at a disproportionate rate, right? And then we, here in the city, 75% of frontline essential workers are people of color, right? And those are people that have to go to work. So if we add that into the equation in terms of people who fearing that they themselves may catch COVID, 75% of those people are people of color, right? And then in general, people of color typically are less likely to work for an industry that supports sick leave, right? And so I may be feeling sick, I come into work because my organization does not support it, right? And so we know, workers without paid sick leave are more likely to come in when they're sick. So if I do feel some symptoms, I might be coming in because I have to come in. I don't get this paid day off, right? So definitely some proportionate effects of COVID. And then in general, it's compounding on systemic issues that people of color have experienced, or people who have been discriminated have experienced, right? We already know that there are structural barriers to mental health support, right? Which oftentimes are systemic issues, right? If we're able to identify that we do want to seek mental health support, there's a shortage of mental health providers, particularly those of color, right? A lot of people of color want to see a clinician that resembles them, that has experienced similar things to them, right? And it's very hard to identify those clinicians of color. There's a shortage, right? Trauma and violence. There has been some trauma and violence during COVID, right? And it's particular around the administration of the rules being enforced, right? I remember last spring, there was a big back and forth about how some people in certain areas were treated in terms of their inability to comply with guidance from the state or from the CDC versus other areas, right? So police were just casually handing out tickets in certain neighborhoods, but in other neighborhoods, they were handcuffing people, arresting people, batting people with batons, what have you, right? These are experiences of trauma and violence, right? COVID has shown this. And then general bias and discrimination has persisted and sometimes has even grown during COVID, right? And we're going to get into some of these how this bias and discrimination has manifested itself in the workplace. Uh-oh. Did my slides went too far? Okay. So in terms of discrimination, experiencing discrimination does have a negative effect on people's mental health, right? Any type of traumatic incident or event has an effect on mental health, and racism, violence, economic insecurity, all these things can be considered as traumatic events. In terms of racial discrimination or just discrimination in general, it erodes people's self-worth. It makes people question if they are worthy, if they are equal or able to be in the same places as some of their colleagues or some of the people who are discriminating against them, right? And this erosion of self-worth definitely has its mental health effects, but also physical effects, right? And so we know that you can experience anxiety, depression, symptoms of PTSD. These are all mental situations that you can encounter because of discrimination, but there are also physical situations as well. There could be chronic stress that develops physically, right? So you can have aches and pains in your body, right? Stress sometimes gets housed in your body physically. There's high blood pressure, right? And sometimes when you're anxious, your heart beats extra fast. The blood starts pumping extra hard, right? High blood pressure. Unhealthy eating, right? And substance use and misuse, right? Can all be physical situations that happen because of discrimination. In terms of the workplace, there are definitely ways that discrimination presents itself at work. A lot of ways that discrimination presents itself at work. One of the things that we like to talk about is changes in people's workload in a negative way. So, we work for particular organizations, and there are sometimes glamour projects, right? And projects that can bring the organization great esteem or bring a team great appreciation. How are those projects assigned? In terms of this could be a discriminatory practice, right? If projects are not assigned equally or equitably, or only certain people get the high level projects and other people get the grunt work or the busy work or the quote unquote housekeeping work, right? Who's being asked to take notes in meetings is an example, right? Then there's other things, unfair promotions. We see that all the time. Certain people may receive promotions and they may not necessarily have earned it or been in the organization as long as someone else or done the same quality of work as someone else. Unequal compensation and benefits, right? Who gets paid what? We already know that women on average get paid, 33 cents less than men, right? So that's definitely a discriminatory practice. And then, of course, even before people join the workforce, there's questionable hiring practices, right? Who gets a look who gets an extended look? Who gets an interview, right? Who gets moved on to the next phase? Who doesn't get looked at all, right? We have heard countless stories of how resumes are viewed based on name. Identical resume, two different names. One person gets a yes, one person gets a no, right? And just in general, lack of diversity in the organization, right? So, we want to see more diversity in all organizations, and sometimes that's not the case. We are consistently hiring the same type of employee, right? So definitely many ways that discrimination presents itself. So real quickly, we want to engage you all in this poll question: how might workplace factors affect an employee's well-being? Right. So we have covered some information. We're going to launch this poll. Please take a couple seconds to respond to the poll. It should be right in front of you. You should be able to access it. Are people seeing the poll? Can people access the poll and respond? Okay. We have a response. Thank you. Now some responses are coming in. Oh, it's the wrong poll, Sophie. I think this is the evaluation poll. Hit poll 2. I see. There was confusion. Oh, here we go. Thank you for someone who pointed that out. Now this is the correct poll. All right. How might workplace factors affect an employee's well-being? Please select all of the answers that you feel apply, or the different ways that workplace factors can affect an employee's well-being. No worries, so Sophie, you're doing great. All right, those responses are flying in, and yeah, this is any one of these ways, and multiple of these ways can show up, right? And so yeah, unhealthy eating. Everybody marked unhealthy eating. So our workplaces are causing us to eat unhealthy, especially during COVID, right? All right. Thank you, everyone, for your responses. Real quickly, if people want to see the results. All right. So yeah, we see that there are many ways that workplaces can affect people's mental health. So in terms of job performance, we mentioned the different ways that discrimination and bias can show up at work, and it definitely has an effect on people's job performance. So you'll see these two charts or these two lists side by side with an arrow in between. It just represents that there's a reciprocal relationship, right? So on one end, you can have increased self-blame and decreased self-esteem, and that could lead to absenteeism or potential turnover. So absenteeism is, physically being absent from work. So that's the calling out, missing the meetings, missing potential projects. So on one side, this list of things can cause you to be absent, to consider turnover leaving. It can reduce your efficacy and productivity, but also on the other end, if I'm consistently not as effective and productive as I want, that can cause increased self-blame. That can cause depression, that can cause anxiety, right? And so discrimination definitely has an effect on people's mental health and their job performance. And, we all want to be productive at work, right? We want to give the best that we can. And so it's definitely a negative situation, right? So, we saw last summer, right, a widespread kind of reinvestment into racial justice, social justice, racial equity, and inclusion. And so a lot of organizations wanted to increase their footprint in diversity, equity, and inclusion efforts, right? We saw that last summer. And so, every organization, I received so many emails of everyone's commitment to Black Lives Matter. So where are we now, right? So we know that everyone was active and about it last summer, and now we're 6 months out. How are people doing? I mean, it's February, so it's Black History Month, so everyone's revisiting it, hopefully, if they left it by the side. But we want to engage in a conversation of how we can continue to work. And it's important that we do, because there's a lot of work that still needs to be done, right? DEI consistently is deprioritized, right? So people made that commitment in the summer, and along the way, it potentially may have been deprioritized, right? And so we know DEI roles, they need to be expanded. At the beginning of COVID, the first few months, we saw DEI roles drop 60% as organizations were trying to figure and identify what is of importance, what are we able to do, what can go by the wayside. DEI was one of the things, these particular roles that went by the wayside. For those of us that do have DEI functions within our organizations, they're often under-resourced, right? DEI teams sometimes are one person who is the director of diversity, equity, and inclusion for this organization. And it's a 300, 400, 500 person organization. That's definitely under-resourced. There's no way one person can do that job, right? And leaders who are in these roles, they're not empowered to make the changes that are necessary, right? They're not able to change policy or to remove discrimination. They're in the role, but they're not given the actual power to make the changes that are necessary. And in general, not necessarily people who are in the DEI role, but people who champion diversity, equity, and inclusion at their workplace are oftentimes penalized, right? And so we see this as another way that discrimination rears its head. So, this person is very outspoken about women's rights. We may not necessarily assign them the same number of tasks, or we may blackball them to this particular area of the organization, right? So we see that people oftentimes get penalized. So how do we maintain the momentum, right? As we mentioned, people were extremely active last summer. How do we continue that, right? And so I'm going to turn it over to my colleague, Sophie, who will talk about some strategies that we can use.
Hi, everybody. Thank you so much, Chris. So I'm going to talk a little bit about the strategies we can employ to promote mental health and racial equity at work. And we're going to deep dive one framework in particular that was created by a professor at Wharton. So next slide, please. When we talk about mental health in the context of racial equity, we can think about the concept of mental health equity. And mental health equity is a term that is defined by the CDC as being achieved when every person can reach their full health potential without inhibition from socially determined circumstances. And for the purposes of today's discussion, those socially determined circumstances include workplaces and the workplace dynamics that exist. So in simpler terms, when we talk about mental health equity, we really mean that your identity should have no bearing on your mental health or your ability to access mental health services. In the context of work, this might suggest that workplace factors don't have a differential impact on your mental health because you're a woman, you're a person of color, you identify as LGBTQ+, whatever your identity may be. So tactically, how can we begin to achieve mental health equity at work? Next slide, please. We can start thinking about this in the context of diversity, equity, and inclusion efforts, and by employing the following 3 guidelines to anchor our efforts and get started. So first, we want to think about enhancing protective factors, focusing on organizational rather than behavioral change, and using a structured and measurable approach to guide our efforts. So when we talk about protective factors, Protective factors can help to prevent mental health challenges from emerging or mitigate their severity. They include strong support networks and relationships. In the context of work, this could include an employee resource group or simply maintaining a strong relationship with a colleague or group of colleagues. They include religious, spiritual, or intellectual engagement. So ensuring you have a sense of purpose at work. As Chris said, making sure that folks have access to challenging and stimulating work. Positive personal characteristics, so having that confidence in your skills and your ability to do your work and being able to take pride in what you leave behind. And then stability of basic needs. So for work, this means consistent employment, it means fair compensation. So for individuals, like what Chris was saying, who have experienced racism and discrimination, working with strong protective factors in place can actually help to decrease the impacts of that bias and discrimination and ultimately support mental health. So one way we can start to enhance protective factors at work, like I said previously, is to think about launching an ERG. So ERGs are typically formed around certain identity groups or areas of concern, like being a parent, having Latinx roots, whatever it is that brings colleagues together. And these ERGs can not only offer support among colleagues, but they can actually also strengthen organizational functioning. For example, they can help with the recruitment of diverse employees and their retention. They can help the organization receive feedback on inclusive products and processes. For example, if you had an ERG centered around, Pan-Asian identities, you might have find a better way of communicating with that community in New York City, rather than using a Google Translate if you don't have in-house translation capacity. The next guideline, focus on organizational change, not behaviors, next slide please, is a tenet of all of our workplace mental health efforts, or at least should be. And this really hinges on the recognition that we don't want individuals to change. We want to celebrate what individuals bring to our workplaces, and that we should first look at how our organizations function. We want to ensure that policies and systems treat people fairly so that people have standardized expectations, opportunities, and rewards. And we want to pursue sustainable strategies that are embedded into the fabric of our organizations rather than one-time efforts. Doing all of this can really take the burden off individuals who, may be struggling due to workplace factors and who are working hard to overcome those mental health challenges, but who, in spite of their best efforts, may not be able to do so due to a psychologically unsafe workplace. And to resolve an issue like that one, you'd have to look at the organization again and not at the individual. Finally, the third guideline is about using a structured approach, like the merit framework, to guide our efforts. Next slide, please. So the merit framework was developed by Wharton management professor Stephanie Creary, and she advocates that the purpose of a structured approach is really to bring about alignment across the organizations, to offer standards, and to promote transparency. And if you've attended TWP's past trainings, you've heard us talk a lot about transparency and open communication as being critical to promoting mental health. And so this framework is interesting because it acknowledges and tries to right two trends in DEI work. So first, it encourages organizations to pursue DEI and in turn mental health efforts as in a long-term and intentional manner, rather than like what Chris said earlier, rather than when it's fashionable or opportunistic to do so. And secondly, it encourages organizations to set achievable objectives rather than focusing on impossible goals. And so in the rest of our time together, we're going to explore this framework letter by letter, and then break out into sessions. So starting with the first letter, letter M, make DEI goals and work actionable, measurable, and evidence-based. E, elevate DEI work internally and externally. R, require leaders and managers to participate in behavior-based trainings. I, identify leaders and non-managerial employees to serve as DEI sponsors. And T, treat DEI work as core rather than peripheral work. So let's talk about what each of these letters means in a little bit more detail to get your minds thinking about how you could enact some of this work at your workplace. So when we talk about making DEI goals measurable and evidence-based, for some of you, you might think of the acronym a SMART goal. And so this entails creating smart metrics and goals that are realistic in the context of the workplace. So let's think about these two goals. 1, eliminate discrimination in hiring. That sounds pretty lofty. 2, conduct blind resume review, which is achievable. So the first, while undoubtedly critical and a dream for probably all of our organizations, is not really something that a DEI team can have total control over. What the team could do is mandate that all resumes be reviewed blindly, again, like Chris said earlier, to remove a biased association with a certain name. This second goal would be smarter and measurable because it can be achieved concretely, and there are strategies that we can pursue to implement it. E, elevate DEI work internally and externally. So elevating DEI work implies raising its rank or status in an organization. At the end of the day, the easiest and fastest way to do that is to involve your leadership. Without the attention of a CEO or executive director, you may risk having this work being cast aside in favor of other priorities. For example, when COVID arrived, there was so much disruption that a lot of our work, like DEI or projects that weren't directly meeting the bottom line, at least quite directly, were cast aside. So attaching resources and time and staffing to this work can build your capacity to maintain the work when crises hit, but also to signal its importance to staff. And with the buy-in of leadership, you might also benefit from communications platforms like town halls or newsletters that you need to message this work across the organization. R, require leaders and managers to participate in behavior-based trainings. So the importance of leaders and managers in shaping, inclusive and mentally healthy workplaces can't be overstated. This is incredibly true for an organization's ability to address bias and discrimination as well. So preparing your leadership and supervisory staff to engage in the types of behaviors that your organization would like to see is going to be essential to influencing the culture of your organization. So if we return to the example of hiring managers, one example of a behavior-based training would be to help them recognize unconscious bias in the interviewing process, so that from the moment a candidate shows up to interview with your organization, your commitment to DEI is really starting off on the right foot. I, identify leaders and non-managerial employees willing to serve as DEI sponsors. So alongside the importance of including leadership in this work, you also want to gain the input of junior and non-managerial staff. And we want to do this for a couple of reasons. First, to encourage a diversity of perspectives and to help the learnings and initiatives of your DEI team to permeate all levels of the organizations. For example, the point of view of a junior associate is going to be different than that of a senior leader, who may not be privy to everything that's happening in the organization, and that junior associate may also not enjoy the same privileges. Chris, it looks like the slides have disappeared. So I'll just pause for a second.
Yeah, sorry about that. I'm having some technical difficulties, big time.
So I can continue without the slides, and we can go into the breakout sessions if it's easier from there. So the last letter is T, treat DEI work as core rather than peripheral work. And I think this one's quite straightforward. So if done correctly, letters M through I of the merit framework will help to position the DEI work that you're doing as core rather than peripheral. So, in some settings, DEI and mental health efforts at work are tacked onto the responsibilities of people. You might be the director of communications and leading, mental health work. You might be the director of programs and leading DEI. To position the work as core, you really want to shift the emphasis to formalizing DEI roles by offering roles and titles that are full-time committed to this work. And also evaluating all staff according to standards that are set forth by the DEI team. So like Chris said earlier, if you have one person thinking about DEI for a very large organization, you're not going to be positioned for success. Whereas if you have a DEI team that is creating systems and accountability measures that everyone in the organization is held to, you have a higher chance of ensuring that these ideas and these principles and these policies are really reaching all divisions. So from here, I'm going to turn it back to Chris. We're going to break into some sessions centered around each of the letters. So I'm going to put the framework in the chat, each letter and what it stands for in the chat as a reference for everyone. And Lily, Chris, and I will be walking you through some conversations. Thank you.
Yes, thank you, Sophie. Sorry, everybody, for the technical difficulties. We're going to get into breakout sessions in a second. I'll shoot you off to the different breakout rooms. I'll be in one, Lily will be in one, and Sophie will be in another. So we're going to have three, probably about 10 people per group based on what we have so far. In each group, we're going to focus specifically on potentially 2 of the letters. I mean, if anything else comes up to you, definitely share it. We're going to have 10 minutes in the group, and then we're going to come back and we're going to share collectively. And during that time, we'll take notes so that we have a comprehensive list that we'd be able to share with people of ideas or things that came up in the breakout sessions. All right. So I'm going to set up the breakout rooms. Make sure that we have Sophie in one, Chris in another, and Lily in another. All right. See you all soon. Mm-hmm. All right, we are, the rooms are gonna close in 8 seconds, so everyone will be back by then. And we're gonna get into conversation. Hopefully each group was able to have a good conversation. I'm going to stop sharing so that we can see whoever is presenting, if they want to be seen. All right, so Sophie's group had ME, which were the first 2 letters of the framework. So I'm saying that they should go first just because it makes sense, ME. So
Okay.
who is the representative from that group?
We are going to have an inclusive approach and have everybody sort of jump in and share. So I think we had a really great conversation, and I'm just going to open it up to the group here.
So I think one of the things that was a theme was in measuring things, right? Whether or not that's taking a numbers aspect where you're kind of tracking participation in whether or not it's a mandatory thing or it's a voluntary thing, and how far into the office is it reaching versus that more qualitative, emotional, how is the group kind of getting along, and the cohesion aspect. I think that was 2 things that were mentioned for part of the measuring.
And also like just making sure like it's visible, like some sort of action plan, and also it's kind of clearly stated as who or what programs or departments may be assigned to specific goals to help with the with participating and pushing through DEI initiatives, as well as making sure folks who, like, if we don't, in short of having an actual role, like making sure folks are compensated for the work that they are adding to the DEI piece.
Another piece was just getting really specific with what the goal is and not trying to have sort of like an overall arching, but just being really targeted with what it is you want to accomplish.
Mm-hmm.
I don't want to put anyone on the spot, but I think one point that was made that was really interesting is thinking about how your organization fits in a bigger like ecosystem. So if you are doing a lot of work in your organization to push these concepts forward, but you're working with agencies or nonprofits, how does that change trickle outside of your organization so that the environment in which your employees work is inclusive? For those that suggested that, please feel free to jump in if you feel comfortable.
Thank you for summarizing. I think that was well said and more concise than what I said. So thank you. Yeah, I guess just to add on, and I really like the idea that sort of the way you framed it, Sophie, around like an ecosystem, right? So like we're not usually acting alone in our work. And so I think I was thinking more immediately of, because we're a public-private program, our sort of like, parent entities, if you will. But I think broadening it to thinking about an ecosystem, I think is really a great way to imagine it, because we're also working with many different community partners and other resource providers. And so, we can do all we can to create, change within our own space, but then how are we connecting that back to our other partners, and what are the expectations we're establishing about how people are interacting with us and so forth. So I appreciated the concept of the ecosystem.
Nice. ME, nice. So definitely making sure that we're measuring a lot of things, not just the quantitative things, not just the numbers, right? But also qualitative things, right? How people are feeling about things, the quality of the events, what are we learning, right? Also planning and making sure that other people are involved. So some aspects of our organization are responsible for these things, other people are responsible for these things, right? So that makes it attainable, right? It's not just all on one set of people, it's split out. And then also, how does this fit into a larger ecosystem, right? So yes, if we do this work for our particular unit, this is how it impacts our unit, but also how does it impact other units, other agencies, other work that we do, right? If I work for a contracting entity, like a city agency, if I have a DEI framework, that can impact the people, how we contract, right? I could write it into the contracts that we RFP for, right? So yes, think about the greater ecosystem. Excellent work, ME. Does anyone else want to jump in on ME before I move to RI? Solid. I can't see everyone, but I see some no's. Good. So RI, which was my group, I'm not going to be speaking. We did have someone who volunteered, so I will turn it over to them.
Thanks, Chris. So for our group, we thought it was critical in terms of who should be involved, that it really is a true cross-sector of the entire organisation. So it would be direct service staff, upper management, middle management. Critically important that everyone is represented in the work. And although I'm presenting for the rest of my group, please do feel free to add in after I go through everything that was said. And just to add to that, very important that everyone buys into it at all of those levels as well, that you need to have input from direct service, but you also need to have leadership to make sure that it really is embedded within the organisation. And the way to do that, to get people involved, is that the invitation should go to the entire organisation. So rather than asking managers or particular work areas to nominate people or select people, that everyone should know about it. And then it might be that they self-nominate. And then if an area is not, although we didn't really talk about this in the group, but if an area is not represented, then maybe you know, people would start to be hand selected, but the entire organisation should at least know about the opportunity, so that people aren't being chosen for, you know, for particular reasons and so on. And to keep people engaged, to set recurring meetings, so there's some level of consistency, to provide, say, for example, monthly updates so that everyone's aware of what the discussion is and what the outcomes are. And also to include, in addition to the formal conversations, to then include it in informal conversations, so that everyone in the group starts to have some responsibility for just talking with their colleagues, just outside of the formal conversations, so that the awareness grows, the importance of it grows, that people see there's some activity around it, and then there might be more interest in people either formally or informally joining the work, and to actively encourage the conversations. One member of our group said it's important to survey, or another way to include people's input is to survey staff, and survey staff, everyone, again, all levels, in terms of what people are looking for and what they want to see, and then also give people updates on, here are the outcomes, here's the work that's being done, this is what it looks like, and connecting with what the other group said about keeping it visible, having a visible action plan and so on. And then in terms of embedding it as core work, not just have the group over to the side, but to bring it back to staff meetings, to bring it back to one-on-one supervision, to make it a standing conversation in the rest of the work. And to ask people, when we're having informal conversations, Chris made the point, which is critical, is ask people, you know, can I share this? That was a really good idea. Can I share it? Can I bring it back? Get permission from people. I think I have everything, but over to my group if I missed anything.
Anybody else from our group jumping in? No, sounds good. Yes, so excellent work, our group, and hopefully, you know, people find that helpful and are able to use that. Definitely one of the things that was mentioned is, in terms of requirement, is that, you know, DEI conversations are required in terms of supervision, in terms of one-to-one meetings, in terms of monthly team meetings, right? Even if it's just an update on what the progress has been, right? So that's one of the things that we covered as well. So we are going to transition to T, which was Lily's group. And yes, we may go over a little bit. You know, we had some technical difficulties. So if you're able to stay, please stay, and we'll try to answer questions and use this time effectively. But T, please present.
Okay, so hi everybody. I led the group, and actually I will also be sharing out the group as well. We did have good participation, so it's really nice to kind of, for T, so the T stands for, again, treat DEI work as core rather than peripheral work, which is something Jacinta just mentioned. And in our group, we had someone who spoke about like identifying what the actual core focus is, which in the case for one of my group members was enrollment targets. And then it's like, how do you incorporate DEI work into that goal? So like identifying certain metrics that we can hit that kind of address DEI. That's a way to kind of see like, what's existing and how it can be incorporated. Another member of my group mentioned that on some annual reports, like that's often kind of expressly identified and addressed in the report itself. Just for example, like newsrooms reporting out and like their writing staff, like, diversity and like what the percentage is. So that's kind of a way to make sure that it's, not only internally, but also externally that DEI is something incredibly important. And then another one of my team members who has like a very, I think, demanding role, and I think this was mentioned in M&E as well, is that it should be very much a collaborative effort, so people kind of share responsibilities and their strengths can kind of be used. So if someone is like, out working and has other things that someone else can kind of help and pick it up. So making sure that there are multiple people kind of holding each other accountable. And then the last that was mentioned was to discuss DEI regularly. So there's emphasis on it. It's just like, this is something clearly important. So we want to make sure to keep talking about it and bringing it up, not just this like, one-time thing when it's like trendy or whatever, but just to kind of keep it consistently important in the conversation. And that's it. That's all I have.
Nice. Was there anything else from T? Okay. Excellent, excellent. So thank you all for sharing, definitely. And we just have a couple slides to go. We're going to answer some questions. I want to put this slide up there in terms of the merit framework. Can definitely be a way for us to introduce this work or continue this work at our organization. It demonstrates leadership's commitment. It establishes accountability, as Lily spoke about, her group spoke about. You want to include all staff, right? So the merit framework does speak about that. You have to include everyone, even the facility staff, if we have facilities, right? They're part of the team. Encourages transparency and communication. And most importantly, it focuses on measurable, lasting change, right? And so many of our statements say, yeah, we're committed to diversity, equity, inclusion, which is great. But now let's dig in and find some measurable ways that we can be committed to the work, right? So this framework definitely supports that. So questions, answers. I know we did see something in the chat earlier, and I know that Sophie responded with resources that are available from our page. We will send this presentation and more information about the merit framework and follow-up email. We wanted to take some notes, so we'll be able to share some of these suggestions that have come up based on our breakout conversations. But yeah, if Alex is comfortable, the person that launched that initial question, with a thread, we can include your email in the follow-up email so people can reach out to you to create that thread. If that person is comfortable with that, please let me know. You could message me directly or just respond to the email that you received today. But yeah, any questions? I'm going to stop sharing so we can see each other again for those of us that are still here. Any questions? Any thoughts? Anything that resonated with anyone?
Hi, I'll just to say that it's really great to hear what other people are working on and experiencing, and it always just feels really helpful and fruitful to sort of have a space to talk a little bit through, the various ideas and ways of approaching this. So, I mean, I would just encourage, I know it's always hard, and as an organization, we also do trainings and there's never enough time for breakout rooms, really. But, if there are any other opportunities for like a part 2 to dig in a little deeper into the breakout conversations, I would personally be interested. I'd love to hear more, from everyone that attended. So just leave that there, but really appreciate the space and the information. This is really helpful.
Thank you for that. And yeah, we may consider an opportunity for just to get people together just to talk about what they're doing, just a knowledge sharing conversation type situation around DEI initiatives that people are doing at their particular organizations. We could make that happen, I think. We could provide that space, I should say. Any other thoughts, questions, ideas?
Just to say thanks for pulling it together.
All right. Thank you for attending. Thank you for everyone's participation. We just want to leave you with a last couple of things. And again, this will go out in the follow-up email. We have mental health support available via our office. We've compiled a list of things that people can access while they're at home for those of us that are at home. And it covers any type of situation that you may encounter. You know, hopefully we want to be as inclusive in terms of things that people encounter. So there's things for food insecurity, those that are victims of violence or, you know, survivors of violence, all types of things that can affect our mental health, ways to access services. And of course, you can follow our page, our Twitter handle, definitely different types of events or resources we love to post all the time. Our handle is there as well. And yep, if you want to reach out to Thrive in Your Workplace, myself or Sophie, definitely shoot us an email. You can take a look at our webpage, which has a list of resources, talks about our model, tons of webinars we've recorded. Like I mentioned, we've done 20 virtual events. Some of those are recorded and saved, so you can view them as well. We have webinars on various topics on DEI and discrimination in the workplace, on burnout, on, you know, vicarious trauma, all types of situations that could be helpful for you and your organization. Definitely reach out to us via email. I sent everyone an email with the link for today's session. That is our email. Those emails come to me. So if you have any follow-up questions or thoughts or ideas, or potentially want us to do something with you at your organization, whatever, just send us an email and we'll move forward with you as best as we can. And the rest of the stuff is our references, which you don't necessarily need to see right now. So yeah, I'm going to stop the share. We'll see each other again. Yeah, thank you all for participating. Thank you for your honesty and bravery in the breakout groups. You know, it's not an easy topic to speak about. And so I appreciate that. We appreciate that.